Labor and breast milk. I chose to talk about labor and the benefits of breast milk because I recently had my first child in January. He will turn 6 months on the 18th. Here are some things I will be talking about today. Hormones during labor, some also things that happen during labor such as Pitocin and Epidural. How milk is produced, the antibodies, types of milk, benefits for the baby and mother, formula, and mastitis. So to start off, I'll be talking about labor, specifically oxytocin first, which is the natural hormone made in the body which starts labor. This hormone allows the uterus to contract, which brings the baby down, of course. Pitocin is a synthetic version of oxytocin. This can help start labor if the woman's body doesn't naturally start on its own, or also speed labor up if a woman has been laboring for too long. The epidural. The epidural is usually given to people to help with pain during labor. This medicine usually has a local anesthesia, but also combined with opioids to decrease the required dose of the local anesthetic. This drug is given through the spine in the epidural space using an epidural catheter. Now, if you look in the picture, that is a very little space, so I did not get the epidural because it just seemed a little scary. How breast milk is produced. A drop in estrogen and progesterone allows high prolactin levels to give a signal to release colostrum. Colostrum is the first milk a baby gets when they nurse, but prolactin is a hormone that causes your alveoli to take nutrients such as protein and sugars from the mother's blood supply and turn it into breast milk. So a lot of women think that what they eat has a lot to do with their milk supply and if the baby feels good, like gas problems and stuff like that, but that's actually a myth because breast milk is made from blood and not what you eat. But oxytocin, also a hormone that causes cells around your alveoli to contract and eject milk down, which is called a letdown. Antibodies. Colostrum. Colostrum is the first milk a baby gets when he or she nurses. This milk contains mother's antibodies, which starts building the baby's immunity. Colostrum had high amounts of Sig-A, which makes a protective layer in their nose, throat, and digestive system. And if you look at the picture on the right, the first one, the top one, you can see colostrum's usually called liquid gold. And if you look, breast milk is white, of course, and the colostrum is yellow. So that's how you can tell the difference when your mature milk starts to come in. How is breast milk tailored to baby's needs? Many people don't know, but when a baby nurses, the saliva enters the mother's body, allowing the mother to make specific antibodies to help fight that baby's sickness. Okay, the different types of milk that are produced. After a couple of days, colostrum turns into mature milk. There are two types of mature milk, which is foremilk and hindmilk. Foremilk is what the baby gets when he or she first nurses. This milk isn't thick and is high in amino acids. Hindmilk comes after the baby nurses for a bit and is more fatty and has more calories. Many women pump through their breastfeeding journeys also to give the baby a bottle. And you can actually see the difference between hind milk and fore milk when you pump and set it out, like in the fridge even. Hind milk will make a little layer on the top, and it's like more of a thick white. And the fore milk, which is the first milk the baby gets, is like more of a clear white. So I thought that was very neat. Benefits for the baby. Breastfeeding reduces many risks of infectious diseases. It also reduces risk of SIDS by 36%. And when babies are breastfed for at least 3 to 4 months, it lowers rates of asthma and allergies. Studies have also shown that there is 15 to 30% reduction of obesity during adolescence and adulthood. If you read that little picture with the baby, there's also some more benefits from breastfeeding a baby. Mother's benefits. Women who have breastfed are less likely to get breast or ovarian cancer. Breastfeeding can cause your uterus to contract, allowing you to shrink back to pre-pregnancy size faster and with less postpartum bleeding. Due to the bond, women who are breastfeeding are less likely to suffer from postpartum depression. Plus, it's simpler and cheaper. When I say a special bond, I mean skin to skin. When breastfeeding, they often tell you to feed belly to belly. This closeness helps build that special bond with your little one. Breastfeeding has also been proven to help infants not internalize their problems later on in life and have diseases such as anxiety and depression. Formula. Some women aren't able to breastfeed even as hard as they try. But formula nowadays are full of the basic needs, but they still lack environmental antibodies breast milk contained. Some mothers also have a hard time finding the right formula due to baby sensitivity, and there's so many formulas out there today. Women who have chosen to give formula other than breastfeed can also use cabbage leaves to dry up their milk. Although this is not scientifically proven, I know many women who this has worked for. Mastitis. Mastitis is when your breast is cracked and sore. Bacteria can enter, causing an infection. You can also get mastitis from not emptying your breast all the way, causing a blocked duct. And if you look at the picture, you can see how it looks red and swollen on top of the skin because of the inflammation on the inside, but that's signs of mastitis that you can look for. Heat, it'll feel hot, the redness. Okay, so the chemistry in labor is how when the baby's lungs are developed, it releases a hormone which makes the mother release oxytocin, making the uterus contract, allowing labor to start. The chemistry in breastfeeding happens when the baby sucks. It makes nerve cells signal the brain to release oxytocin, which makes mother's milk eject. The same hormone is released during labor and breastfeeding. I think that's pretty cool that our bodies can do such amazing things, and both use pretty much oxytocin, like the main hormone. But I hope you enjoyed learning a little bit more about labor and breastfeeding. This is my works cited page. If you would like to learn more about the benefits of breast milk or labor, feel free to look at any of these. Thank you.